everyone. So today we are going to be doing just kind of a short lecture on techniques that are used within session and between session. And so a lot of this will be kind of a reminder of some of the other pieces that we've talked about over the course of the semester, but just with kind of more detail of what they might look like and how they might be used. And so when we come back to talking about this, something that is important to touch on is going to be just that idea of what is useful within therapy. And so we've done this question before where we've kind of thrown it out there and asked, and often you're going to kind of hear this metric where like 30% of um, the like move to change, the ability to change in sessions is going to be related to like that therapeutic alliance. Like how well is that relationship built up? How much trust is there involved? How do they feel? Like, how comfortable do they feel with you? And so that's going to be a good portion of what's going on. Where the remainder of it is going to be, what are these specific techniques used? That'll be one that will be kind of important. And it also kind of feeds back into the relationship where if you're comfortable with the techniques, if you're familiar with the techniques, if you conceptually understand them, you're going to be able to approach it a little bit better. And then we have, client expectation. How much are they willing and able to be a part of that? What level of like contemplation are they in? Are they ready to jump in? Are they still kind of not really thinking anything's wrong? They're not thinking that they feel anything has to change, and so maybe they're not buying in as much there. Or then you have the rest of it being outside of the counseling setting. And so that could be environment, that could be relationships, that is kind of everything else going on. They spend a majority of their time outside of the session, and that's going to have a big impact on them. And so that's something that we keep in mind. And so there are going to be times where we say, hey, we want to have these things put in place. We want to practice these things. We want to learn about these things. And we're not going to have enough time to do those in session. So that's where you bring in things like homework or journaling. And so that brings that little bit of, hey, we have all this stuff going on outside. We're going to push it over and we're going to say, here's a little bit of that therapy that we're going to bring into this, and we're going to continue the thought, we're going to keep developing those skills, we're going to practice a little bit. And so implementing these different forms of outside stuff is going to be really important when we talk about like hitting your treatment goals, when we talk about longevity, when we talk about like buy-in. And so when we talk about putting homework in place, when we talk about implementing this in general, it can be really, really helpful for those clients that are really self-motivated. They find it empowering. They find that it's concrete. It's something that they can do. It's something that they can say, okay, I'm going to give this a try. And so keeping that in mind, and also keeping in mind that that might impact different people differently. Some people may not be as interested in developing these things outside of therapy, and that resistance might be something that you work on inside and kind of see where things are going. And so this is a really broad one, but when we were talking about putting in homework, it's something that's kind of across the spectrum of how and when it's used in different techniques and different theoretical orientations. And so it really, I think, brings out some of the things that we talk about in session and says, okay, here it is in the outside world. Here it is where it's very real. And so when we talk about implementing homework, it's really flexible on what we were putting in. It might be something where we ask them to try and do a coping skill 3 times a day, or we have them, write out some stuff during the week, or do some sort of experiment or expose themselves to a fear of theirs. There's all of these things that we can implement outside of session. And when we're looking at putting them in place, one of the things that we're going to want to ask ourselves is what is the point of this and how does it connect to the goals that we're working on? Does it connect to broader goals? Does it help build a skill that we're working on? And so when we look at like kind of full implementation, I'm going to give a few examples. But when you look through and say, hey, I want to put homework in on this client, there's a few questions that I think you should ask yourself, and there's a few kind of things that you want to set up beforehand. So, right off the bat, you're formulating it. Maybe you're coming to it together with them. You're talking about it. You're saying, hey, like there's this um, concern that we're having. Let's go ahead and do some of this practice over the week, and throwing it out to them and saying, okay, what is going on? What is happening? And so we put it out there. We say, hey, go ahead and try this homework. We put out that recommendation. And then we say, how are we going to know that you did it? Is it going to be a journal? Is it going to be written? Is it going to be something we talk about? And that just gives the client some motivation to bring something back or to actually do it outside of session, and can just be a little bit more of that, um, like that click of, okay, I do have to do this. I'm going to jump into this. What does it mean if I miss it? And pulls them in a little bit more. And then, yeah, you just watch for, they go ahead and put it in practice outside of session, whether it be 3 times a day, once a week, situational. And they come back and the therapist just asks about it. What was going on? How did doing that homework go? What did it look like? And you guys can determine on how much you want to share about it, whether it be let's read over it together, or I want to hear about this experience, or I wrote a journal about it and we could just talk about it. And so then they report it to you. They give you that experience. They kind of tell you as the clinician what connections they made to it. And you see if it was helpful. You see if it was effective and if it's something that you could continue to implement. And so I have a few different versions of um, like what homework might look like in different orientations. But if we're talking about things like CBT, that's one where homework is like kind of a core aspect of that theoretical orientation. So you might be doing something like activity scheduling for behavioral activation, which can be helpful when you're dealing with depression, decrease hopelessness. And it's just kind of saying, okay, hey, let's do one of those activities you like to do. Let's have a fun activity that you enjoy, that maybe you've been struggling with since you've been dealing with depressive symptoms. And then you schedule it, you participate, and then you write about it. You talk about it afterwards. You just kind of reflect on the experience. Thought records are always going to be kind of a core one that happens when we talk about homework, where it's tracking, like thoughts. Maybe it's the unconscious thoughts or the um, kind of maladaptive thoughts. And so you could say, hey, I'm going to track that. I'm going to write it down when it happens, how I felt, what the behaviors was, what the situation was, that kind of thing. Or maybe you're just asking them to do, graduated exposure and you're saying, hey, we're going to put ourselves out into this kind of fearful situation, whether it be social or insects or anything like that, and mark it on the SUD scale. Like, let's see how um, severe that response was. Maybe if we look more on like existential, it might be a meaning making activity, like a daily meaningful moment inventory where they're writing out the things that they found meaning in over the day, or when they journal about life, purpose, or even do like a value sorting activity where they go outside a session and try and put together some of those values that they find important. For REBT, you might have them do like an ABCDE log, maybe some Socratic questioning when they're running into things where there's a discrepancy. Maybe if you're working with Gestalt, maybe they're doing I statement practice where they have to put I statements, those I statement reframes into practice to get used to it, to get comfortable, and to be able to communicate better that way. Maybe there's, unfinished business letter writing. So maybe they have someone that they want to talk to, or maybe that they have someone that's passed that they have some things they have left to say. So they can go ahead and write that letter outside of therapy and then bring it in and you guys can discuss that experience. Maybe if you're going with like solution focus, you can just give them homework by saying, hey, we had the miracle question. Um, Give that some thought. Like, let's come back and talk about that after you think about it. What might things look like? What things may change in that miracle question setup? Or maybe you just ask them to say, hey, over the course of this next week, I want you to write down exceptions to the rules when it comes to how people will treat you, or things that you're kind of finding with the people around you. And you're just saying, okay, hey, write these down and come back and we'll talk about it. And so it's bringing it in that reframe those thoughts into their daily life. And so when we talk about usefulness, this is homework in general has kind of been seen to be useful across the spectrum. whether it be anxiety, obsessive compulsive, depression, social phobias, personality disorders. And some of those they need more homework than others. Some of them will pull outside of the session more than others. And knowing when to implement and being purposeful on that homework is going to be such an important aspect. And so the next two that I'm going to go through very much kind of like fit in certain subsections of what we're talking about with homework, but you can kind of think of them a different way and implement them in a little bit of a different way. So when we talk about bibliotherapy, this is really that idea of, okay, we're going to take in some writing, we're going to take and give the client the ability to read something that they might connect with and pull it into the counseling process. And so when we're putting this in practice, we're wanting to really be aware that we want to understand like how a client can identify with the characters in the book, in the show, whatever medium we're using, and have like a set up way to debrief or a set up model on how to interact with the book. Are we talking about it after every week? Are we doing a journal to reflect on it, or we're writing about like aspects of the book? And so when we're talking about implementing bibliotherapy, one of the important things is to kind of look at the goals that we have set up in mind. Um, you know, we want to possibly have a focus on like teaching constructive and positive thinking, like readjust and restory or reframe some of those positive or negative maladaptive kind of tendencies. Encourage free expression of problems, which I think any kind of creative medium can do a good job of. Assisting the client in analyzing his or her own attitudes and behaviors. So having some of that perspective changing that we do when we read, or looking at similar situations to maybe what they've gone through or they've thought. Fostering the search for alternative solutions to problems. Same kind of thing. It's saying, hey, we're going to reframe this. We're going to get out of this kind of internal um, tunneled view of ourselves and of what we're going through and say, hey, how might these other things kind of look like? What other possible solutions are there? And then allowing the client to discover that their problems are similar to others. I think that can be a really helpful aspect to take in because it destigmatizes mental health just a little bit. It tells them that they're not alone, and it opens up some avenues that maybe they thought were shut down and takes away a little bit of the isolation that I think sometimes comes up. And so when we're talking about putting this into practice, there's a lot of different variations of what this might look like. But one of the things that we're just right off the bat looking at is identifying clients' needs. That'll be kind of our first thing. What is an appropriate book for them? And that I think is a bigger question. So selecting that appropriate book, you'll be looking at developmental. Are they going to be able to read well what you're putting out there? What's their kind of reading level at? What are they comfortable reading or enjoy reading? And what's appropriate for their situation? Is it one where it's more of like a self-help book? Is it more creative writing, poetry? Is it just based on experiences for something else? And I'll show a few examples of books that might work. Um, and so you'll find the one that works for them. And I would really recommend only using the book, like using a book that you've read personally, because I think that gives you the best kind of insight into how helpful it will be, overtones, undertones, whatever else is going to be used in like those novels. I think it's really important that you're very aware of that going in. So I would just make sure you read each one before you put it into practice. Um, the and so you'll kind of get those books out there, and then you'll ask, are we going to read this book? Are they going to read it on their own? Are you going to read a little, bit of it in session? Is it going to be a book that parents read to their children? What is it going to look like, and when are they going to do it? And then have them read it. And so, maybe they read a chapter, maybe they read a few pages, and then you come back and you talk about and debrief that in session. Maybe it is talking about how that character's changed over time or how they got through hardship. Um, and then open it up to what does that kind of connect to in their experience? Is there something that that character did that they like to implement? Is there something that they found helpful from reading that experience? And finding those like gold nuggets of important experiences, I think will be really helpful when we talk about putting in bibliotherapy. And so when we talk about what the books might look like or what it might look like when we're putting it into practice, it's really going to depend on what you're wanting from that experience. So maybe it's literally just, hey, here's a self-help book. It talks about getting through something or about how someone interacted with something, and they can read that and say, okay, I'm going to take these notes from it that it says, and I'm going to try and do that. Maybe it is more creative writing where it's a novel or it is a short story where they go through a narrative and maybe there's something that they connect with. Maybe it's poetry where they can feel like they can hear or get out their emotions or connect with the emotions on it. And so there's different ways that these might be put into practice too, whether it be that informal kind of there isn't a specific thing that we're going through each session or in the big groups that they go in. So maybe your bibliotherapy is you recommending, hey, join a book club and see what those experiences might look like. And that would just be kind of open conversations. What do people get out of it? What do they feel like talking about? Or, come to that traditional where it's like, here is a book, read through it, take what you can from whatever skills are described, morals are described, whatever else, and focus it on a specific thing you're going through. Or, you have it more interactive where you're having a discussion, you're reading through the book together, and you're actively doing journaling or a group discussion like each time you come in. And so it's constantly kind of being checked up on, it's consistently changing, and the day-to-day of what it might look like looks a little differently. And so there are going to be other times where there's a specific focus in terms of what you're looking for from it. When we talk about clinical things, maybe those books are specifically about like role playing and skill development. Maybe they're drawing to get expressions out, those kind of thing. Where if we talk about developmental, that's like, a lot of the times the books that I will recommend will be um, like books about puberty, something that helps them understand some of the things going on internally. Maybe it's about depression, maybe it's about aging. It's more of like an educational or cognitive where it's like that's where I kind of go back to those self-help books or those like CBT toolboxes that I'll often use. And so it's really useful in a lot of different situations, whether it be I think there's just about a book for everything. It's just how you can bring it into session and make it feel like there's a connection with that client. And just a few examples of like books that I've used in the past. So this book I think does a good job for teens when they're maybe dealing with stigma about mental health. Maybe they're just looking for a connection from someone like a written kind of someone else. And so I'll go ahead and show this, but it is absolutely normal short stories that smash mental health stereotypes. And it's just a bunch of small stories written in different ways. Some of them are like poetry, some of them are just narratives. One of them is like a comic, and it talks about struggles and mental illness in a different way. And that way, I think people often can connect with and say, okay, hey, I do understand other people go through this, and I have kind of seen how that comes out. And so that's like one example, one of a more narrative driven example. But then we also have things like, acceptance commitment therapy toolbox. It's just kind of a book with a bunch of different things that we can implement or skills that we can put in practice or just self-reflection activities that clients can use. Therapy games for teens. So this is more something where they can say, okay, how can I put this like fun game into practice where it has a therapeutic helpfulness? And I think there's a lot there. There's also, I think there's a couple classics that we think of when we think of bibliotherapy. Um, The Body Keeps the Score, A Terrible Thing Happened, a story of children who witnessed trauma or violence. Those are some of the ones that I feel like people will go to often. If we're looking at movies, Inside Out has been such a good one for kids. and connecting the things that they enjoy and putting it in a way that they can understand well. And so that one's a recommendation that I often hear. And then go outside of it a little. Maybe there are, when you talk about movies that might be helpful, maybe there are video games or comic books. Maybe there's TV shows that all kind of fit and have a narrative that can be helpful or they can connect to and find things that are helpful for them. So yeah, let's hop over into journaling. So this is one that we've talked about quite a bit, as just kind of being a integral part of a lot of different kinds of therapies. It's a very flexible piece of homework for clients as they can kind of do it anywhere and do it in kind of any way that they want. It just depends on how you want to implement it. And so this can be things where maybe it is just directly reflecting on on the session. How did it feel afterwards? Maybe it's reflecting on a novel that was recommended or homework they did. Maybe it's just a daily journal or an affirmation journal that they're filling out. And when you want to look at some of the reasons why you might put this in practice. And so, maybe you do just want to hear the emotions, the effective, hear those ideas, have them put them out. Maybe you want to kind of focus more on emotional expression and release. And so have them write out some of the overwhelming emotions or having them be able to express some of the things that they struggle to in person or vocally. Maybe you're focusing it more in on themselves, meaning making, self-discovery. What are their values? Have them write about that a little bit. Cognitive ones might be more so like the column structures where it's like, what was the behavior? What was the feeling? What was the thought? And they go through and write each one out where it's a little more structured than just like a free write. Thoughts, feelings, and behaviors, that kind of thing. And when you focus on that meaning making stuff, maybe that's something that you say, okay, like, hey, we have this list of values, write why they're important, write why you feel like they matter to you. And so you can go completely non-directive where it's just open, it's writing out a thoughts, it's pretty short. Or you can go structured. You could do the columns. You can do Socratic questioning, maybe where you have it written all out. And so when you think of putting these into categories, something that you kind of want to keep in mind is that um, where does your focus have on what you're wanting for session? So is it poetry? Is that focused on emotionality? Is that focused in on expression? Is it storytelling? Do you just want them to get out some of the things that happen? Do you want that to feel more natural, or do you want it to feel more like it's more um, in their normal life, or do you want them to exaggerate a little bit and put it over the top? Do you want them to write something kind of like an autobiography where it's just about them and about their history? And you can have them do that. Maybe you do, say, hey, like, let's go ahead and write about this really important part of your life. What did it look like from your perspective? Maybe it is just keeping track of like homework and writing diaries about how it felt to do an experience, or if we're talking about that fear response, maybe it was a writing about how it was to confront their fears. And so I think all of these kind of fit under that same umbrella of how can we take these things and how can we remind clients of this outside of session? How can we do it in a way that they find interesting and helpful? And so a lot of these, I think, really revolve around that idea of building self-awareness and um, like coping skills over time when we ask them to bring these up. And so just kind of keep that in mind when you're implementing it. And well, honestly, at homework in general, something that I would recommend is just talk to your client about it a little bit. Are they interested? Is that going to be something that they say, hey, I don't want to do this. The second I hear homework, I'm going to kind of shut down. Or are there ways that you can put it into practice that they do enjoy? And think outside the box a little bit. This doesn't have to be just written in a notebook. It could be through an app or through voice message like memos. Like there's a lot of different ways you can implement journaling and other pieces of homework without it being like, hey, go write on a piece of paper. And I would say the same thing with bibliotherapy is if you feel like there's a good story that has been told, don't really care as much about the medium as long as you can get it in the client's hands and you can talk about those connections that they continue to make. So yeah. I think that'll be all of our information for today. I appreciate your guys' patience through this semester, and I hope you guys have a great day, and I will see you guys in our next class. Goodbye.